Now it's time for our special guest, our main guest. He's someone literally on the front lines of the medical challenges we're facing today. American Medical Response, or AMR, currently serves many East Valley communities, including the city of Mesa. Joining us today is the VPO and COO of Arizona and New Mexico, Mr. Glenn Kasprzyk. Glenn, welcome to Mesa Morning Live on this afternoon. And please correct the proper pronunciation of your name.
You said it perfect, Mark. It's Kasprzyk, trust me. I only have one vowel in there. I've been, tortured all my life with my last name. So I go by Glenn K, but it's great to be here today.
Well, I'm still working on Kamala, so I'll put yours on my next project. Wow. So I know the catchphrase that you mentioned earlier was, or that we talked about, was "Mask Up Arizona." COVID. You know, a year ago, if you said COVID, nobody knew what you're talking about, and now it's all we're talking about. Give us your perspective on this.
Yeah, these have been extremely unprecedented times, right? I mean, we have gone through significant challenges as a community, as healthcare providers. It also, I think, has acted as an incubator for healthcare entities to do business differently and try and provide services to the community efficiently and effectively as people need different levels of care when they're having an emergency. So our provider health and well-being has certainly been a challenge. We kind of consider this a triathlon event. I think most everyone in healthcare would agree with me on that, is just working hard to take care of people, take care of our providers, and make sure that we're adapting and protecting people as we're providing care. You know, you mentioned mask up, everyone wear a mask, and I know people get tired of it or complacent, but we are making a difference, and it's helping our healthcare providers, and we're doing it for them. So that's really the message: is protect yourself, protect us. And we'll get through these challenging times. I think, if we all, like you said, get back to normal life, we would love to do that. I don't think that's going to happen anytime soon, but it's not going to change for a bit. And we got to do what's best for the community and work hard and have conversations and do things that protect ourselves.
Well, that's well said. I know it's changed a lot of what used to be normal routine. I called my health club, and they're closed, and evidently have been since 2004. I had no idea, but that's just me. Well, tell us a little bit. How has it impacted the normal workplace in Arizona and also New Mexico?
Well, I think, when I look at the service area here in Mesa, which is an area that we've served for many years, and beyond that, it's presented challenges. It's put extra stress on the crews. We've had to adapt to different ways to respond. We've had crews from the local area deployed to other areas like New York City and New Jersey for hotspots, working with them to ensure that they have, their mental health and wellness when they're returning is being taken care of. We're providing tools to make sure that they're safe, their family members are safe. Personal protective equipment. When you look at the amount of personal protective equipment that's now required and we're using and higher burn rates, that has created challenges at times, especially early on in the pandemic, as everyone was trying to get those pieces of equipment so they could give to their providers. But fortunately, I think as we've done a good job in our community to try and slow the spread, we've also adapted as healthcare providers to make sure that we're doing the things that are right, that we're providing the care, protecting our providers, and doing the things that make meaningful impact and taking care of each other. As I said earlier, I think it's really about taking care of each other and taking care of our patients and our providers.
Well, as we look down the road, hopefully in the not too distant future, in a post-COVID world, what does ambulance service look like?
Well, it's going to look different. So, there's always going to be those, critical level calls, heart attacks, strokes, trauma patients that need those fast emergency responses. But what we started doing through the COVID pandemic is we started going to alternate destinations, freestanding ERs, places where lower acuity patients could be treated. We also are looking at, and communities are now using nurse navigation. So when you call 911, you have the ability to talk to a mid-level provider. So when you have a lower acuity type condition, I have the sniffles, or maybe I'm symptomatic to COVID, where do I go and get into healthcare to be able to get the care that I need to get healthy again? We're going to have to evolve. I think forward looking, I think healthcare in general, what impact has this had on future recruiting of people into healthcare, not just EMTs, paramedics, firefighters, nurses, any healthcare worker. A lot of the things I hear in speaking with our providers is they're not necessarily scared for themselves. They're scared that they're going to bring something home, infect their families, and then something bad happens to one of their loved ones. So I think forward looking, there's been a lot that has acted in COVID as an incubator to really force healthcare to look differently, where we've sometimes been more risk adverse at times, that we should do what we normally do because this is how we've provided care to the community for the last 20 years. You have to look at things differently. It's presented challenges, but I think organizationally for us, and even on our healthcare committee, Aging and Healthcare Committee, it created us to pivot a little bit to look at things differently and see where the needs of the community were and what we could do to make things better for those that are suffering in our local communities.
Sherry was just on prior to you, Glenn, and I know that you and Sherry are co-chairs for an important chamber committee. Shed a little light on that for us.
Well, it is absolutely a great committee, and Craig's on the committee, and it's a very diverse group of healthcare providers and organizations that take part in this committee. And Sally, when she came up with the idea, it was really relevant to where we were going, albeit before COVID. But it was great that we actually got started before COVID with aging and healthcare, because we want, as Sherry mentioned, the very successful Dementia Friendly City program has been a hallmark. I'm very proud of that accomplishment and the work that the committee put into making that happen. For one, really jump-started us. But two, the other piece with this committee is not only having a diverse group of members, is we have congressional representation at our meetings from both Senator McSally and Senator Sinema's office, which we have been able to communicate the needs that we're seeing here locally in Mesa, or the needs individually of those organizations that are providing care to people, such as those that may be in nursing homes or aging facilities, or are struggling even just in their own home because of social determinants of health. We've had a two-way street, and I think that's not only helped Mesa, it's helped Arizona, but it's also created some great direct access for our members and the organizations to provide a unique personal perspective on the challenges that COVID has presented to us as a specific industry or as a community as a whole.
That's great. Well, I always like to ask our guest, because Mesa is such a great active community, what can folks at home, what can they do? What can we do to help your cause and to help make Mesa and the East Valley a better place to live?
Mark, great question. For one, look, we have a great chamber. We have a lot of great members. We have a lot of active members. And I think the thing that I would tell people at home or other businesses is, one is, if you're not a business and you're at home, visit the Mesa Chamber website, visit the City of Mesa website. There's a lot of resources available that can help you get things that you need through this challenging time. If you're a business, get involved with the Mesa Chamber. And even if you're not in healthcare, when you look at what Sherry mentioned about dementia cafes and helping businesses improve and dealing with certain types of patrons that come in that have some physical disability or life challenges, that makes a better business. It makes a better community. And I think the commitment here is to provide as much information as we can, be a source of truth for those at home, have a resource link. You don't have to be a chamber member to see many of the resources that are available. And then it's tied into what the city offers. So when you're feeling at home and helpless at times, there are a group of people that are willing to help, that can provide levels of expertise and can get you connected with those more directly to help you get through your challenge that you're having or get resources that you may need.
That's great. I know that you're very active with AMR and trying to make Mesa and the community the best place, the safest place to live and work. This is kind of a tough time because a lot of people have more time on their hands than they've ever had, not due to COVID. And a lot of times I think if you volunteer and get out and do some stuff for other people, it can make you feel better, get you through this. So together, I've grown to hate this saying that this too shall pass, but it truly will pass, and let's come out of the other end of this better than we went into it, if that makes sense. Thanks, Glenn, for your commitment to AMR and to Mesa. Anything else you'd like to? You are the special guest. Anything you'd like to sing? Maybe accompany Blaine on some music?
You don't want me to sing, I'll just keep my mask on here.
There you go.
Mark, your point, right? Even though you're home, get out, get engaged. There's many of civic things that you can get involved in your community. It will make you feel better. It gets you active. Get outside. It's been a tough 5 months for many people, but there is light at the end of the tunnel, and just be active. There's a lot of great things in the community that Mesa offers, the East Valley offers, and take advantage of that. And maybe there was time here for everyone to go out and discover some new things. This is the time to do it because you have more time on your hands.
That's right. Well, this isn't like 20 years ago. Technology has made it where you might be stuck at home, but you can be virtually anywhere. I mean, you've got the internet, your cell phones. You can stay in touch with people in unprecedented ways. So yeah, there's always good work to be done. And Glenn, we appreciate you spearheading so much of this. Thanks for all you do.
Great. Thank you. And thank you for having me today.